Yay.
Hey,
Carry on.
all right. Good afternoon, everyone. Welcome to Track A, the Community Services. My name is Lynetta Haynes-Turner. I am the Chief of Staff to Cook County Board President Tony Preckwinkle, one of the leads of the Intergovernmental Municipal Coordination. You will hear a little bit about shortly, and very honored to be with you all this afternoon. If you've been with us since the morning, I hope you found all the information you've received by our state, city, and county partners helpful as a first step to readiness. The entire day's presentations have been recorded and live streamed on Facebook. All agencies will also be posting those on their respective websites and on our joint Greater Chicago Together website after the event. If you're just joining us now this afternoon, welcome. There will be lots of helpful information as our presenters from all levels of government provide you with who they are, what their anticipated ARPA-specific investments will be in the areas of violence prevention, health and human services, and public health, and how you can partner with us in this historic moment as we leverage the nearly $10 billion of ARPA federal relief funds and other economic recovery funds across Illinois and Cook County that will help improve the lives of many of our residents in the communities where they live and work. A reminder again that if you're interested in Track B, Transportation, Infrastructure, and Sustainability, or Track C, Community Development, the Zoom links are in the chat, and we won't hold it against you if you leave us if you've joined the wrong Zoom link. Now that we've done all of the housekeeping tasks, let me give you a sneak peek of the agenda for this afternoon and how the flow will happen. Each segment will last 45 minutes with 30 minutes of presentations and 15 minutes of Q&A. We have asked all presenters to keep their remarks to 10 minutes so that everyone has the chance to tell you exactly what they are doing. The chat function has been disabled, but at the end of the 30-minute segment, we will open the Q&A feature and take as many questions as we can. Sumiki Watkins, the county's Director of Intergovernmental Affairs, and Christina Rivero, Legislative Coordinator from the county, will be here helping us today. We know we may not get through all of your questions and we may run over, but rest assured this will be one of many opportunities to hear directly from the state, city, and county on their work around ARPA investments. Without further ado, let's go ahead and kick off this segment with the first slide, featuring violence prevention. And I will handle the first few slides and then I will turn it over to our presenters. So I mentioned at the onset that we have an intergovernmental municipal coordination. We've been working collectively from the state, Icee, IDHS, along with JEO, and the city of Chicago, along with the Department of Public Health and DFSS and Cook County in concert, since we all recognize and received the federal funds that are coming through for ARPA. This is unprecedented collaboration. It is hard work. It can be messy at times, but we have been intentionally focused on making sure that we are not duplicating resources and maximizing the impact of these investments over the next 3 to 5 years and the communities that need them. We've been working specifically on the violence prevention release of the solicitations and other opportunities that will be available for many of our residents, as well as direct service providers who will be partnering with us to deliver those services. Next slide. So during the work since about June of 2021, our staff across all of these agencies have been working to really look at our violence prevention, our existing efforts in terms of the investments that we made and what we are going to do with ARPA. We established common goals across all of our offices. We looked at our definitions, whether you're thinking about violence reduction efforts using a public health lens. We reviewed data and we came away with 2 shared priorities around intervention and our solicitations and capacity building. Next slide. So this group, Intergovernmental Coordination, you'll start hearing from the first one through Illinois Department of Health and Human Services. But we had two priority areas that we've been working on and we will continue to work on in partnership. The first one was really trying to align the various solicitations that all units of government will be putting out. So we have been very thoughtful about trying to streamline the process for our applicants and our recipients and maximizing the targeted impact of those funding. So we've looked at everything from the timing of when solicitations will go out, how we may coordinate communication to all of the applicants, what are some common definitions, for instance, street outreach or eligible services, or what it means for individuals at highest risk of violence and what those target populations are, so that all of the individuals' applications that we receive, there's some uniformity and some standardization across what you will see. And we've also started to talk about common data and methodology. Now, of course, there's a lot more work to be done and we're pushing up against time constraints. So today is really just a high-level overview of where we are. We have much more work to do, but we want to make sure that you all understand that we're committed to doing the work for as long as it takes so that we can partner with you all and you can partner with us to get these funds out where they need to be. The second area that we've been working on is around our approach to capacity building. We know that many organizations, whether you're a micro organization or a larger organization, may be in a different place for your development and where you are as an organization. Some organizations may need a lot more information and assistance, technical assistance, to help them figure out how to apply for one of the public funding. There are some organizations, maybe those who are mid-sized to larger organizations, who need specific help around data or metrics or grant administration. What we want to do is make sure that we are aligning, again, avoiding duplicative efforts, but also trying to make sure that we can scale up and achieve our outcomes together. So for that area, we've really started to talk about what types of capacity building or technical assistance will be offered, both pre-award, but also post-award if you are able to receive funding from one of the units of government. We want to also, and we have been talking about who's best positioned to provide that type of support and where we can really coordinate. One area that has come up over the course of our planning meetings has been around data and evaluation. So one example of that coordination could be that the state, city, and county around these violence prevention funds agrees to enter into a partnership where all of our grantees perhaps will be working together on evaluation and measuring that impact over time. We want to make sure that these resources are really going to the communities who are most impacted by violence. We have the data per capita around shootings and homicides. And we really want to make sure that at the end of these 3 to 5 years, we have made a marked difference, decreased the incidence of gun violence, increased community safety, and really provided the opportunities in many of these communities that have been disinvested in, the opportunity to have safe and thriving communities. So that is where we are with our broader coordination. I want to go ahead and turn it over to our first presenter, Christopher Patterson, and he will run through all of the wonderful opportunities through the State Office of Firearm Violence Prevention. So Chris Patterson is the Assistant Secretary, and you are on. So turn it over to you to provide background information.
Thank you and good afternoon, everyone, and thank you, Lynetta. Next slide, please. So I want to say it's an honor to participate in today's Readiness Summit. We've put a lot of work into this idea of collaboration, but also communicating to the public the amount of work and resources going into our efforts to reduce firearm violence across the city of Chicago, Cook County, and the state of Illinois. I've spent my career as an advocate and community organizer, determined to reduce violence from the grassroots up. I am so heartened to see so many people and communities participating in today's summit and claiming this moment to collectively heal, restore, and transform our city, county, and state by working together to reduce firearm violence. Together with Governor Pritzker, Secretary Ho, and our sister agencies like the Illinois Criminal Justice Authority, along with our crucial partners, the city and county, we will make a difference in preventing and interrupting firearm violence. Next slide, please. In November, the governor announced support for a 3-year, $250 million state investment to implement the Reimagined Public Safety Act, the data-driven and community-based violence prevention initiative. $50 million in funding has been budgeted for the remainder of the state's fiscal year 22, and we will pursue $100 million in appropriations during state fiscal years 23 and 24. Next slide, please. Through the Office of Firearm Violence Prevention, our Firearm Violence Prevention Research Group developed a process for identifying the areas of most concern for firearm violence across the city and the state. Within that, we created 22 eligible communities in Chicago and 15 communities outside of Chicago or Greater Illinois. Identifying these eligible communities by January 1, 2022 was a specific requirement of the Reimagined Public Safety Act. Next slide, please. You can see here from this slide, here are the 22 communities in Chicago area in which Reimagined Public Safety Act funds will be channeled. I'll give you a couple seconds to look that list over. Next slide, please. Here are the 15 additional areas outside of Chicago or Greater Illinois in which we'll be receiving funding from the Reimagined Public Safety Act across Illinois. And I'll give you a couple minutes to look that list over as well. Next slide, please. Organizations serving these eligible communities will be able to apply for the following: technical assistance, training, and grants that will give organizations and providers additional support, community conveners for the Chicago area communities, violence prevention services for Chicago area communities, youth development programs for statewide and Chicago area communities, and high-risk youth intervention programs for young people to keep them out of the justice system and support them with mental health services. Ultimately, our goal is to reduce violence, in part by creating positive pathways for young people to live out their full potential and create vibrant communities across our city, county, and state. Next slide. As many of you know, we launched the Office of Firearm Violence Prevention and are pleased to share the following NoFolds, or Notice of Funding Opportunities, available for community to apply for. Here are the dates in which we anticipate having those NoFolds out to the public, as well as release and award times. Next slide, please. Here you will be able to access those grants online. So please visit idhs.illinois.gov/OFVP for more information on the Office of Firearm Violence Prevention. I invite you to apply, join the effort, and stay connected with IDHS, Office of Firearm Violence Prevention, in the coming weeks and months as we continue to work to prevent and interrupt firearm violence. Thank you very much. And with that, I will pass it on to my colleague.
Good afternoon. I am Delreese Adams, Acting Executive Director for the Illinois Criminal Justice Information Authority. And as Chris shared with you early on in his presentation, this to us is a very important collaboration amongst city, county, and state. And what you'll hear from Icee in this administration through the Governor Pritzker as well as Lieutenant Governor Stratton is not only are we concerned about investment in community, but we want to make sure that communities have what they need to be successful as all of this funding, unprecedented amounts of funding, comes down from the federal government. So we will talk a little bit, or I will talk a little bit in Icee's presentation about our capacity building and technical assistance, as well as policies that we've implemented to shape more equitable funding. And then also I'm going to talk about our violence prevention plan, which I encourage you to go to our website to really use it as a tool and a resource. It has data resources attached to it so that county level data and community level data can be utilized for a collaborative table to really make out plans and strategies to address the violence issues that are unique to your community area. So I'll start with an overview of Icee, and if you could go to that Icee slide, the next one, please. Icee, if you don't know, is dedicated to improving the administration of criminal justice. We are the state administrative agency responsible for close to $300 million in state violence prevention funding and the administration of the Restore, Renew, and Reinvest program. We also administer $100 million a year in victim services federal programs, in addition to conducting research to inform criminal justice policy and grant making. Icee's role is to convene key leaders and stakeholders from the justice system and the public to identify critical issues and to propose and evaluate policies, programs, and legislation that address necessary reforms. Today, we are going to center our information on violence prevention, where Icee received the bulk of our ARPA dollars. Next slide, please. In September of 2021, Icee launched the statewide violence prevention plan. It is a 4-year comprehensive plan developed in collaboration with over 130 stakeholders in 7 state agencies. The plan centers around equity and community healing, aimed at moving the state collectively towards restorative justice and trauma-informed best practices and data-driven interventions. It is the instrument for sustainable efforts and impact beyond ARPA dollars. As we all know, violence is a public health issue. Like COVID, there is a cause and a cure. Prevention begins the cure, but what are the root causes of violence? Poverty, racism, and disinvestment. This administration has made a commitment to invest in communities most impacted by violence. Icee's violence prevention portfolio has nearly tripled under Governor Pritzker and Lieutenant Governor Stratton. Next slide, please. Icee will administer in fiscal year 23, $80 million to fund our R3 awards that will focus on civil legal aid, youth development, economic development, re-entry services, and violence prevention. $20 million of coronavirus emergency supplemental funds that mainly center around re-entry housing. $55 million has been allocated to us through ARPA funds for violence prevention and technical assistance and capacity building, as well as $22 million in line appropriations for trauma centers and violence prevention services by designated entities. And we also have $8 million in community-based violence prevention programming. Next slide. Under my leadership, Icee has implemented a number of innovative community-focused strategies to improve how the agencies have traditionally administered state grant funds. We've heard many of the feedback, many of the complaints, to be quite honest, of how difficult it is to oftentimes administer your grant funds. And so we have increased our technical assistance by providing a variety of application training opportunities to ease the process for smaller and less experienced community agencies to onboard with state dollars. We're also very excited to introduce the development of a new institute to innovate, which we're calling Eye to Eye, which will provide expanded technical assistance programming to support grassroots organizations and community groups committed to changing the circumstances of violence in their communities. Eye to Eye will be a resource for these partners to increase their capacity for grant management while onboarding to state funding. We will also help create a path to sustainability for these many small key organizations that do the critical and crucial work in our community. We also created an equity scorecard for our grant applications. Questions that can help us measure equity have been added to the application and scoring rubric, where we can award points to organizations centered in impacted communities, staffed by persons that reflect the communities being served, and have leadership that are also from historically disenfranchised communities. We understand and acknowledge that historically, many of our Black and Brown organizations have been left out. And so our equity scorecard is a way to right that wrong, a way for us to leverage the playing field and give organizations an opportunity to compete with some more experienced organizations. Icee has also developed policies that expand how we provide funds to agencies committed to doing the work. As you know, the state uses a reimbursement model. Icee has developed an advanced pay and working capital policy to address those burdens. And that will allow agencies to have money upfront and not have to wait on the reimbursement while they begin their programming. Next slide, please. Icee will issue 4 NoFolds in late March, April around our ARPA dollars. These NoFolds will seek services in 3 areas: street intervention and community violence interventions, multiple violence prevention and intervention services, and violence prevention services such as housing, workforce, and other supportive services. These NoFolds will be separate according to geographical areas, but will all be released at the same time. Our goal is to target those gap areas that are not covered by the Reimagine Public Safety Act that Chris Patterson shared with you earlier, or our 3 eligible community areas. And so we want to be intentional about making sure that these ARPA dollars, that they're leveraged and that we are leveraging each other's resources across the city, county, and state, and that Icee can kind of go in those folds of where some community areas would not be lifted up or identified through the other mapping and eligible community processes. We will also cover suburban and collar counties across the state who have high rates of violence or a recent trend in uprise in violence. I just want to really focus on, like, this is a unique opportunity for communities to come together and really propose innovative solutions and very community-centered solutions and give us, like, make the case to our agencies on what trends are you seeing? What specific strategies do you think your community need? And we're looking at those proposals through fresh eyes. We're not going to be as scripted in what the services should be. We want communities who we know oftentimes have the solutions to really come to the table with those approaches. In fiscal year 23, we will issue $20 million in ARPA funds. The average award of our NoFolds will be approximately $200,000 to $300,000. I will end Icee's presentation here. We gave you a lot of information. If there are questions, please reach out to our office. We will put our email and website in the chat. And I will now hand it over to one of my favorite people to work alongside, the Executive Director of Cook County Justice Advisory Council, Avik Das.
Thank you. Good afternoon. Thank you, Acting Director Adams and Assistant Secretary Patterson, for your presentations at the state level. Thank you to the organizers of this Readiness Summit. Thank you to all in the audience. I'm glad that Cook County can be a part of this collaboration, and I hope people see regular themes running through this with our shared focus on addressing violence in particular and addressing gun violence. So I'm the Executive Director of the Cook County Justice Advisory Council. We operate under Cook County Board President Tony Preckwinkle, and we lead collaborative work across system and community stakeholders to advance the President's criminal justice and community safety agenda. And of course, a central focus of that agenda is addressing violence and crime to help our residents and communities be safe and thriving in the suburbs of Cook County as well as the city of Chicago. Our mission is to promote equitable, human-centered, community-driven justice system innovation and practice. And we carry this mission out primarily through 4 interrelated areas: policy work, service coordination, community engagement, and grant making. And we're going to focus on grants. If I could get to the next slide. So, working through this slide from left to right, I would like to draw attention to our existing grants portfolio of the Cook County Justice Advisory Council, or JAC. In our current grant portfolio, we have several major categories: violence prevention, recidivism reduction, restorative justice, services for returning residents, and employment services for emerging adults. The JAC has granted out over $50 million in the past 8+ years, growing from a yearly appropriation back in 2015 of $5 million to over $14 million in the current fiscal year. And our largest funding area is violence prevention at an annual allocation of approximately $7 million and 43 active grants, with our next largest allocation being services for returning residents at $4 million and 28 active grants, and across our portfolio, we have over 100 service providers. These providers directly support our communities, particularly Black and Brown communities, disproportionately experiencing the impact of historic disinvestment, crime, violence, and contact with the justice system. So accordingly, our grantees primarily operate in the south and west sides of the city of Chicago and south and west suburban Cook County. The work of our grantees across the portfolio all intersect, they reinforce each other, but our services ultimately center on violence prevention work. The programs can include street outreach and violence interruption, alongside mental health and therapeutic services, education and employment services, and individualized services such as mentoring and case management. JAC grant making is intended to be as inclusive as possible for diverse community-based services to reach residents closest to where their needs are. The services we fund are not meant to be one size fits all. They are meant to be evidence-informed and community affirmed. We want to build and improve upon our existing approach for our upcoming rounds of grant making with ARPA funding. Next slide. So what's next? We are just a few weeks away from the first JAC round of ARPA grants focused on gun violence prevention and intervention services. This grant opportunity reflects the urgent and enduring commitment of President Preckwinkle's administration and county government to address the record incidents of shootings and murders involving guns in Chicago and Cook County. Out of about 85 million ARPA dollars budgeted for JAC violence prevention grants, this first round will consist of grants totaling up to $50 million to service providers focused on addressing gun violence and its root causes. Each grant award will be for a period of 3 years, and there is flexibility in size of each grant applied for, as well as the kinds of services funded, provided there is a key focus on gun violence. The applicant or lead applicant must be a recognized 501c3 or C4 organization at the time the proposal is submitted, have been in existence for at least 3 years, and have previous violence prevention, intervention, reduction, and community outreach experience to be considered for a grant award. This round of grants is intended to come alongside city and state grants in service of those geographic areas of Cook County with the highest concentration of fatal or non-fatal shooting incidents. So we're talking about suburbs and Chicago and different sizes of grants and applications. The timeline for grant solicitations, the application period would open early March, close early April, with review and approval by mid-May and awards made by mid-June. So stay up to date by visiting the hub for all these grants at every level, greaterchicagotogether.org, as well as engagecookcounty.com. We will also be posting info about our VP ARPA grants on our JAC website, and we'll email periodic updates. And for the summit, we really want to emphasize that we're working together, and the greaterchicagotogether.org reflects that. And now I'm hoping to pass the baton to our leadership in the city of Chicago. Thank you.
Thank you, Avik. Good afternoon, everyone. My name is Rebekah Estrada, Deputy Commissioner of Youth Services for the Department of Family and Support Services. I can't seem to start my video, but that's okay. Oh, there you go, start my video. Hi. Again, good afternoon. My name is Rebekah Estrada, Deputy Commissioner of Youth Services for the Department of Family and Support Services. As we pivot to the city investments for violence intervention, it is critical to understand that this approach to violence prevention is through a broader lens of community safety and addressing the root causes of violence. Violence in our urban area at its core is a symptom of the disinvestment, structural racism, and neglect that has occurred in our communities of color, resulting in widespread poverty, trauma exposure, and lack of educational and employment opportunities. Next slide. Our funding allocations for ARP and our general operations budget reflects our overall strategy. we have dedicated $85 billion in ARP funds for violence interventions and $52 million in general operating funds for crisis response services like victim services, programming to support interventions with those at risk of violence, and to enable place-based strategies. We're also dedicating over $315 million in ARP funding to addressing youth programming, increasing housing access, addressing vacant lots and buildings, and supporting workforce development for returning citizens. Additionally, there is $25 million in gender-based violence reduction programming that will include rapid rehousing, legal services, youth services, and emergency funds. This is on top of other city initiatives such as Invest Southwest that are investing billions of dollars to address disinvestment in our most vulnerable neighborhoods. I will now turn it over to Marlita White, Director of Administrative Services from the Chicago Department of Public Health.
Good afternoon. We can go to the next slide, please. What we're going to do now in our remaining slides is really unpack what exists as the funding opportunity in that first tier of funding that you saw on the previous slide. $10 million will be funded to support victim services. This is funding that will support data-driven and trauma-informed initiatives and services that support persons at the highest risk of involvement in and impacted by serious and potentially lethal violence in prioritized communities. We can go to the next slide. And then of the $45 million that really sits under violence reduction interventions, 11.5 million is going to be supporting the coordination of a whole of government approach from a new community safety coordination center in service of community. This means bringing the resources of government to bear to support a community-driven, hyper-local approach to violence prevention. 16 million will support evidence-based community safety initiatives. This includes the development and launch of an anti-violence marketing campaign to raise awareness about the root causes of violence and address the behavioral change needed to reduce retaliatory shootings, supporting the organization of block clubs, especially on our most violent blocks, and providing the resources needed by our residents to protect their property and feel safer. More to come with respect to these initiatives. We will have announcements coming forward in the coming months. And then finally, 18 million will go toward increased and sustained funding for violence prevention initiatives. We're still working on those plans and analyzing data that will help us to determine where to specifically apply this funding, and we will share as those plans are finalized. And I'll turn it back over to Rebekah.
Next slide. And so the Department of Family Support Services Youth Service Division has received the $30 million for youth intervention and justice diversion. The youth intervention programs will focus on holistic wraparound services for youth with more complex needs. Youth within these programs may participate in jobs programs like One Summer Chicago or mentoring, but employment would come along with other services and supports like case management, trauma-informed mental health supports, legal services, family engagement, and more in order to comprehensively address a youth's needs. The target population is youth ages 14 to 24 at the highest risk of violence who live in the 15 community areas in Chicago facing the highest levels of violence as outlined in our City, Our Safety Plan. This population is more challenging to reach and serve as they often are disconnected from schools or other traditional institutions. Youth in the target population may have a history of experiencing violence, be actively gang involved, have a history of arrest or incarceration, and or may be facing other complex needs. For the youth justice diversion, the justice diversion investment will support the implementation of a new deflection and diversion model in Chicago. The Mayor's Office, Chicago Police Department, and DFSS have been collaborating with stakeholders in the development of this new model for one that will be trauma-informed, services-oriented, and limits the role of law enforcement. Through these efforts, we have discussed core components of the model to focus on risk assessment factors, engagement of youth and families, communication and relationship strategies that encourage accessing resources and completion of services by youth and families. We anticipate taking a hyper-local approach to working with youth and families and will make referrals for services that are aimed at prevention, such as mentoring, enrichment, One Summer Chicago, workforce programs, SOAR centers at CPS, to interventions to provide violence reduction, such as mental health, behavioral services and programs, our service coordination and navigation, or SCAN, and restorative circles. For these programming investments, DFSS anticipates rolling out RFPs within Q2 for a programming start within Q3 2022. And with that, we have concluded our portion, and I believe we are opening it up for questions.
Yes, thank you, Rebekah, and thank you to all of the presenters for this first segment around violence prevention. We have seen a few questions come up, and so we are going to do our best to try to answer them. Some of them we've been able to respond directly to you, and others we want to make sure that everyone is able to hear. So bear with us as we start and make sure that we are addressing all of the questions. Early on, there was a question around what communities are on the list of the 22 communities that IDHS set up. And so Chris Patterson, what is the best way, aside from these presentations all being posted, for them to understand what those communities are that's available for funding?
We will post those on our IDHS website. So I would encourage folks to go there. It's attached to a letter from our research group that identified the areas within Chicago and outside of Chicago.
All right. And another question along the same line is, if we are not in a listed community, but we serve youth who live in any of these communities, are we eligible to apply?
So for the Reimagined Public Safety Act, we're prescribed to a limited number of communities within the city and state. But if we recall, Director Adams from Icee responded to maybe this inquiry. So Director Adams, can I pass this over to you if you're able? About the gap area.
Sure. I'm sorry, can you repeat the question?
It was a gap area.
Yeah, there's a question about whether or not, if you're not in one of those communities, but you're serving youth who live in those communities, are you still able to apply?
Yes, so as Chris mentioned, Icee's ARPA grants, when our NoFolds are released at the end of March, beginning of April, there will be opportunity to go beyond those community areas that are targeted either by the city, the county, or DHS. So again, there will be opportunities for various proposals to be submitted that are not centered in those specific areas. So that's why we call them gap areas. So if you fall outside of any of those mappings, you will be able to apply for funding through Icee.
Thank you. There is a question about how can we get funders to understand the need for some of their funds to be allocated for conducting effective evaluations. So I will say it's certainly something that all units of government who's been part of this collaboration has been thinking about, making sure that we have the technical support on board. Our academic partners have really worked with Icee, IDHS, the city and the county to make sure that we are targeting the right places and that we really are using data to inform. So evaluations and research and really wanting to make sure that we understand all of the outcomes over the next 3 to 5 years certainly is being discussed. It is a commitment that we all share, and we are being intentional about trying to strategize about what exactly that will look like. So there's some general questions around posting. So as you guys can imagine, each of these agencies are putting out their RFPs at different times. And so please feel free to go back to their websites. You can also always visit the Greater Chicago Together website, because we're going to post information and link them to all of our respective websites, but that is the best way to check periodically to see who's posting what RFP when. Also, once you are looking at the actual solicitation or RFP, all of the details will be there in terms of what the technical assistance is that's being offered, what the timelines are in terms of when your proposals need to be in, what the eligibility criteria, and how those proposals will be scored. So there are going to be a lot of details once those solicitations are posted. And Del Reese has put in the chat, there is a link there if you are interested in being a reviewer for specifically for the R3 grant opportunities, correct, Del Reese?
Yes, but as we collect reviewers, when we have other opportunities, we will pull from that list.
All right, so we have time for a couple more sessions, a couple more questions. Are the target areas inclusive of downstate cities? So I will say that the answer is yes. I think a lot of the focus today has been on the city of Chicago and Cook County, I'm sorry, specifically suburban Cook. But Chris, any thoughts, you or Del Reese, on what's going to be available for downstate cities from a state's perspective?
Yeah, from IDHS, and I'll lob it over to Director Adams after, is there will be 15, or there are 15 municipalities outside of Chicago that have been identified by rate and volume. Again, you can find those locations on IDHS website to identify where those will be. In relation to ICEJA, Director Adams.
Yeah, so ICEJA, again, we will cover the remaining parts of the state, again, that are not kind of mapped in Reimagine Public Safety or any other municipality. So yes, we will focus on downstate cities.
All right, thank you very much for all of the presenters for the violence prevention segment. We are going to pause on the questions so that we can hear the next segment. And we have Secretary Grace Hull from the Illinois Department of Human Services that needs to be able to share her information with her department. Those questions that we have not been able to answer, we will do our best to try to address at the end of the afternoon. So turning it over to Secretary Hull.
Thank you so much, Lynetta. And thanks for your leadership and facilitation. It's really been, I think, groundbreaking, the work that we've been able to do together, the state with DHS and ICEJA with the county and the city. So it's a pleasure to be here. I'm going to zoom out a little bit. I want to say thank you to our Assistant Secretary, Chris Patterson, and Director Adams for focusing the discussion earlier on violence prevention. But I just wanted to pop in and say hello, give my regards, but then also provide a little bit of an overview of the Health and Human Services budget. As many of you know, the governor just announced during his State of the State and State of the Budget address the proposed budget for fiscal year 23. And we gave all of our sister agencies in the Health and Human Services portfolio provided a budget overview on Wednesday, and that is also available at the DHS website if you would like more information about all of the Health and Human Services budgets. The good news is the total Health and Human Services budget for fiscal year 23 is dramatically increased over the previous year. We are very excited to have the support of our governor for the important services that we provide to the state of Illinois. So in the Health and Human Services portfolio, of course, we have the Illinois Department of Public Health, the Department of Children and Family Services, the Department on Aging, Healthcare and Family Services, and then of course, the Department of Human Services, where I serve as the secretary alongside Chris Patterson, who is our assistant secretary. So very simply stated, our vision for the Department of Human Services is that all people in Illinois achieve their full potential. And we have a variety of values, but one of the values that I wanted to make sure to lift up was that of have a racial equity, constant mission to strive to become an anti-racist organization. We have 6 divisions within the Department of Human Services, the Division of Early Childhood, which is our newest division. We just launched it last year. We have the Division of Substance Use Prevention Recovery, Rehabilitation Services, Mental Health, Developmental Disabilities, Family and Community Services. And all these divisions work together in an integrated way to provide critical supports for families and neighborhoods across the state. Sorry, go ahead.
And Grace, I think they should be advancing your slides. I don't see the slides advancing.
I don't think that I was just gonna, to speak to them. I don't think that we submitted slides in advance. And Lynetta, am I supposed to pause for interpretation, or is interpretation
it's ongoing, so no, you don't have to pause.
Okay, sorry. Thanks, Lynetta.
All right.
So very simply stated, we have 5 broad goals centered on work, food, nutrition, home, housing, health, and of course, safety. I think if you have the opportunity to go visit our website, we have our presentation on our website that really highlights the different areas of work that we are going to be launching. And of course, in particular, violence prevention is prominently highlighted. So I want to talk briefly about our COVID-19 response. We, in partnership with the Department of Public Health, were able to administer 40,000 vaccines to staff, residents, and to individuals through our community-based outreach efforts. We were able to deploy almost $1 billion in federally funded child care relief funds to child care centers and providers across the state. We were able to administer almost $2 billion in food and nutritional supports to 1.4 million children across the state. In addition, there was another $2.5 billion in additional SNAP benefits to almost 2 million active SNAP households, and on and on. One of the critical things that our department has been trying to do is to support those who needed us most over the course of the past several years. Other COVID-19 response items included $50 million in sustainability payments to support a behavioral health community-based provider system, $60 million of ARPA funds to expand youth employment, and there will be opportunities for community organizations to apply for youth employment funds in the coming weeks and months. So please look out for that. I would say that for organizations who are interested in keeping up with all of the notice of funding opportunities that we have with the department, the best way to do that is to sign up to receive our newsletter. It's a monthly newsletter, and at the end of every newsletter includes all of our notice of funding opportunities for your information. We've worked very closely with the Illinois Housing Development Authority to deploy funding in the form of rental and utility assistance to ensure that people could stay in their homes over the past several years. And we're working very closely with our sister agency, Healthcare and Family Services, to support our community mental health centers and our substance use provider across the state. So in a nutshell, fiscal year 23, our proposed budget that the governor introduced on Wednesday was $11.6 billion, which is almost a little bit over a 7% increase over our fiscal year 22 spending. We are going to continue to use those funds to invest in frontline staff, including our childcare program, our home service workers that helped care for people with disabilities in their own home, as well as to support community-based organizations as they budget for minimum wage increases. Our goals for fiscal year 23 obviously include the launching of the Reimagine Public Safety Act under the leadership of Chris Patterson and the team that is working with them. We need to continue to preserve the safety net as we recover as a state and a country and a world from COVID-19, protect the health and safety of residents, patients, and staff. And then at the Department of Human Services, we are charged with several grand challenges in making progress to creating solutions systemically to poverty, to hunger, violence, welcoming immigrants, and homelessness. And we look forward to working with many of you as we know that many of these issues are deeply interrelated. So other highlights in our budget include additional appropriation authority to use cannabis tax revenues to support a behavioral health system, increased investments in naloxone, as well as workforce training. We want to continue to expand mobile medication assisted recovery, as well as expand services to address the social determinants of health and expand harm reduction strategies. We're increasing wages for people who care for people with developmental disabilities, as well as to people with disabilities broadly across the state. I think many of you are familiar with the programs that we have outside of Reimagine, which include Teen Reach, the Welcoming Centers, Immigrant Integration Services. We've seen increases in several of those areas, and so invite you to continue to keep in touch with the work that we do. So there's a lot of information that is on our website that we provide on a monthly basis. We do want to continue to diversify our provider community, and have stood up very strong GATA technical assistance efforts. And so we don't want GATA to be a barrier to state funding in any regard. And we really invite you to reach out to us if you have any other questions. And I think my colleague Jose is on with us and will be available to answer any questions at the conclusion of this panel. Thank you so much, Lynetta.
Thank you,
And to
Secretary
everyone.
Ho. And could you or Jose quickly, there's been a couple questions around providing the link to the Human Services newsletter that you've mentioned and how
Absolutely.
to access that.
Yes.
All right. Thank you very much. And we're going to now move to the next presentation by the City of Chicago. We have the Department of Family and Supportive Services, Brandy Kanazi, who is the commissioner. Brandy, turning it over to you and your team to present on the city's efforts around human services.
Thank you, Lynetta, and it is a pleasure to be here this afternoon with everyone. I am joined with Raymond Barrett, who is our Director of Research, Planning, and Development. Next slide, please. So I'm gonna not read our mission because everyone can do that, but really just to give you an overview of DFSS. We are the city social services arm for the city, and our goal are to deliver and support high quality and innovative programs, collaborate with community partners and our sister agencies, inform the public of resources and available. Our goal is really to make sure that individuals and agencies who need support have easy access to them and be good stewards of resources so that they're operating effectively. Our main mission at DFSS is to make sure that we're able to demonstrate impact for the resources that we place in community. Next slide, please. Just a general overview of the department. We have a budget of about $790 million this year. That includes our base budget of about $404 million for our base grants and over $386 million in CARES, ARP, and bond investments. Through our community partners is how we get the majority of our work done. We work with a network of over 350 community-based organizations or delegate agencies, which translates to nearly 1,600 contracts a year. The majority of the funding that we put into community for our base grants last year was over $346 million. In addition, not only are we a funder in the Chicago area, but we are also a direct service provider. So individuals can walk into any one of our 6 community service centers throughout the city to receive wraparound services, as well as receive referrals and other community supports. We also provide a network of 6 senior regional centers where seniors can come in, dine in, they can do fitness activities, recreational activities, and get connected to services as well. Next slide. Broadly speaking, DFSS serves everyone from birth to the senior years. This afternoon, I'm going to focus on 5 of our divisions that are in our Chicago Recovery Plan, and I'm happy to talk offline about the additional programs that we have. What you'll see on the slide is not only the what we do, but how we deliver services in communities. Next slide. So first up is our Domestic Violence Division. This year, we are investing in additional resources, including prevention and education. This RFP will be looking for a provider to help us educate individuals throughout the city on gender-based violence. In addition, we'll be releasing services for legal services to provide legal representation within the justice system, but also justice navigation. We understand that individuals who have been faced with gender-based violence need help not just with the actual legal services, but that navigation and walking the path in order to get connected to services. We're investing $4.5 million in rapid rehousing. What we've seen during COVID is just the need to stabilize folks into a home. And so this money will support quickly being able to put individuals within housing and support them with other services for 1 year. The $5 million investment in the emergency fund will support individuals with cash assistance in their immediate need. You know, the real thought here is that sometimes all a person needs is money to fix their car so that they can get to work, or support basic needs like food assistance. We want to make sure that we have a flexible fund to support individuals in how they need. And so we'll be looking for an administrator to manage that fund. Last, what you see on the screen are $5 million in services for youth services. And this will really support young people who have either been witnessed violence or who have experienced violence. And so the trauma and the therapeutic and emotional supportive services that go along with that will be included in that RFP. Next, please. In our homeless services division, we work with a continuum of over 50 shelters throughout the city. And we have a number of outreach partners that we work with. What we've learned during COVID is really the importance of having a stable shelter structure. And so many of the grants that we receive only support the actual services. So the cost per bed for operators to run their shelters, we're investing $20 million in shelter infrastructure. And so this will support organizations with the ability to provide partitions, or if they need to rearrange their large congregate settings to individual rooms, we've learned that that is really important in reducing the spread of disease, not just COVID, but other communicable diseases. This shelter infrastructure money will also support investments including roofing repair or boiler repair, as well as accessibility access for our shelters. We really want to make sure that we're able to support organizations, large and small. The second opportunity is the Permanent Housing and Other Services Initiative for $71 million. This initiative will be in support with the Department of Housing. We're really looking to procure a motel or a large unit and turn that facility into an interim shelter in the short term, and then longer term, use that for permanent supportive housing. Next slide, please. Under our Human Services Division, this is really where we provide support and public assistance to individuals and families. And so through our cash assistance program that we're calling the Chicago Resiliency Fund, we're working to provide cash assistance to individuals. The first one that you see is a monthly cash assistance program that will provide $500 a month to 5,000 people for 1 year. what we know is that the best way for individuals to lift themselves out of the hard economic situations that they have been through COVID, and those who have been hit hard by COVID, is to allow them to have agency to determine what they need in order to gain economic stability within their families. And so that RFP is out right now for an administrator, and you can find it on our website. There's also a second RFP that's out for a outreach and recruitment provider as well. And so you can find both of those RFPs on our e-procurement website, and the due date for those RFPs is February 18th. At the end of the month, we'll also be releasing 2 additional cash assistance RFPs, one for individuals who have been excluded from previous stimulus payments, as well as a cash assistance program for domestic workers. Both of those programs will provide one-time payment assistance of $500 to individuals. Next slide. Our Youth Services Division provides a range of services for youth from ages 6 to 24, and we offer a variety of programs for youth who are engaged, and we want to keep them in school, all the way up to youth with complex needs and at the highest risk of violence. And so the first thing that you'll see under our ARP programs are job programs for $65 million. Currently, we have 3 RFPs that are also out for release right now on our procurement website. The first one is our traditional jobs program for the Summer Youth Employment Program. That's a 6-week summer program. Chicago Ability, which is a program for 14 and 15-year-olds, that we consider those tweens who they're not ready for a job because they're not 16, but they feel that they're too mature for a summer youth program. And so rather than go to day camp, we help with career exploration, and they receive a stipend for that program. The last program that falls under that broad category of jobs programming is a new program we've initiated, with this our Chicago Youth Service Corps. And this is a leadership development and civic engagement program for young people. We're happy with our investment in the CRP plan that we're able to provide that program year round. And so youth will work in the Chicago Youth Service Corps to develop programming and initiatives in their community that they feel responsive to. And at the end of each session, they'll have a capstone project where they'll really work in to solve issues and challenges in their own community. And we're really proud of the work that that Corps is doing. We also are investing $20 million in youth intervention for young people who may have had involvement with the justice system, and we really want to get them back on track. We are developing a diversion and deflection program model. That's a new model that we will be releasing within the next couple months for $10 million. I just also want to highlight 2 non-ARP programs that I feel are important. This year, we'll be releasing our youth mentoring program to ensure that youth who are in school at CPS are able to be attached to a mentor, and then youth enrichment will also be going out later in Q2. And that's really for after school and our summer programming. Our traditional youth programming is what that is. Next slide, please. Our workforce program, we are investing $10 million in reentry services. The real goal for this is to not only reach people once they have been released, but to pre-release services. And so we want to start working with folks before they leave the correction system to make sure that they have a plan. We want to make sure that they're connected to jobs and then other support services and navigation supports that they need. In addition, through our apprenticeship program, we want to make sure that we're developing career pathways for individuals so that they can be sure to have that. Next slide, please. The release dates, I know we talked broadly about them. I just want to make sure everyone can see the timing for when the various RFPs that we'll be releasing for our ARP grants will be released. And so you can see the quarters here. Next slide. And then I'm going to turn it over to my colleague Raymond, who's going to talk about what it takes to apply and best practices here. Thank you.
Thank you, Commissioner. Good afternoon, everyone. As the Commissioner said, my name is Raymond Barrett. I'm at the Department of Family Support Services, and my job today is to provide some quick,
Mi
impactful
trabajo
tips
ahora es darle
to get you
información
ready,
impactante.
aka the Readiness Summit, to apply for various RFP opportunities at the city, regardless of the department that you may be applying for. So first, thoroughly review the RFP, its requirements, including the required attachments and its deadlines. This is the most important foundational tip of this slide. Everything that you need to be successful as an applicant is contained in the RFP itself. It explains the needs of the city, the type of program that it's important to solve these needs, and how this program should be accomplished. It is how your performance will be assessed, how you will be monitored, and most importantly for today, how you'll be scored, which gets into our second part. Review the scoring guidelines for the RFP and complete every section of the application. Here at DFSS, every RFP contains a scoring guideline, and that's, like I said, in the RFP itself. When we review applicants, we have to adhere to the scoring guidelines. You see your questions, or see your responses, we table them up, aggregates to a score, and that's how you get awarded. So whenever you're answering a question in the application itself, it's being weighted to something in the scoring guideline. So if a portion of the scoring guideline is heavily weighted in a particular section, you should spend more time in that section. Additionally, every response on an RFP application is tied to a score in the scoring guideline. So if you leave it blank, you're probably going to get a 0 for that response. So make sure you respond to everything, even if it's brief. Next, clearly define the services and include strategic partnerships. Explain in clear terms how you're going to accomplish the program with the resources you have, the resources you may need, and the impact you will create with these resources. And include the community members that will help you out to accomplish this. We all know every great problem takes a village to accomplish, and we don't expect you to work in a silo. Mention those partnerships. Additionally, align the budget and narrative. One should reflect the other. Our readers are taking in your application holistically, and all of your numbers have a story behind it. Tell the story in your narrative. Your narrative should reflect every aspect of your budget. Next, provide data and evidence-based approaches when they're applicable. We read so many different RFPs and applications. You have to think of an application as an argument of why your organization deserves this particular job. And good arguments need solid evidence. So when you can, include it, and it's going to make your argument more convincing. Next, emphasize your organization's unique impact. You're special, you know this, so say it in your application. It's going to really help you stand out. Also, uplift your organization's cultural competency lens and diverse leadership. At DFSS, we value partnerships with organizations that are conscious of the community demographics that they serve and how that is reflected in their own organization's leadership. Lift up your diversity. It matters to us and to our communities. And lastly, provide honest, sincere goals and outcomes. Do not provide exaggerated accomplishments. We know budgets. We read them all the time and know what is reasonable and what isn't. So be sincere and authentic, and it's going to benefit you way more than you know. So sadly, that's all the time I have for today's session, but I hope these tips are helpful for your next application to the city. And I wish you all the best in your endeavors. And now I'm going to turn it over to Patrick Combs at the Chicago Cook County Workforce Development Board.
Thank you so much, everyone. And thank you, Lynetta, for hosting. Next slide, please. And so I am Patrick Combs. I'm the co-acting CEO of the Chicago Cook Workforce Partnership. Next slide. Thank you so much. So the partnership operates the public workforce system for Chicago and Cook County. So we do this through a network of delegate agencies throughout the county. We have over 100 service locations. We touch over 140,000 people a year and 1,000 businesses. We are unique in that we cover both city and county, and also we have two big customers that are both job seekers and businesses. We deploy our services using an equity lens, so we target communities with the highest need. And sadly, because of the pandemic, that's only grown over the last year. So we try to reach as many communities as we can that has the greatest need. And as we've seen over the last 2 years, not only the public health toll, but also the economic toll that families have faced due to the pandemic. So we really try to be thoughtful in how we target our investments throughout the county. And so we are not for profit. So like a lot of people on this, out there viewing, we understand kind of what you're going through. So we are not for profit that is designated by the city and the county to operate the workforce system. So we are able to leverage not only federal and local funding, but also philanthropic funds to really reach the people that we're trying to serve. Next slide, please. So our vision is we want every family in Chicago and Cook County to have access to the support they need to really achieve economic mobility and economic resiliency. We've heard a lot over the years about family sustaining wages, and although we really work hard to make sure we're doing everything to sustain families, we don't want to just sustain families. We want to help families build wealth and build generational wealth and get out of the cycle of intergenerational poverty. So family economic mobility is one of our top priorities and really focus on the whole family. We know that if one person in the family gets a job, that the whole family kind of changes the whole family's economic outlook. So we try to work through not just an individual, but an entire family. Also from there to community stability, as many people have talked about in the different sessions today, the economic impact on anti-violence efforts and kind of community uplift efforts throughout the region. So again, we know that if there's wealth going into communities, that if people are employed throughout communities, that it helps stabilize communities, and then it helps, again, make impact throughout these other community level issues. We always try to do everything through an equity lens, racial, gender, and digital equity. That was a big plank we added in the last couple of years as we've all pivoted to virtual. Now we're kind of pivoting hopefully away from this virtual world. But we've seen how the digital divide has changed, not just workforce, but also education and many impacts for different families throughout the region. And then collaboration, we know we can't do it alone. Again, we work through 91 delegate agencies that are CBOs, nonprofits, big and small throughout the region to help us do this work. We are very good at workforce strategy and operating these federal dollars, but we really target partnerships with community-based organizations that have the cultural competency and that are trusted messengers, so that when we try to deploy these services throughout communities, they know that what is being served is something that would be truly impactful for their families and is not just another workforce program run by another agency. Next slide, please. So regional employment and engagement. So this is really kind of getting to the crux of ARPA and what everyone here has been talking about. So we're trying to mobilize the region's family serving infrastructures, again, to make an impact across an entire family, not just for youth, not just for adults, kind of in the classic workforce model. So we're coordinating the opportunities that have been created through ARPA to augment what's already happening with our workforce dollars and with our partners such as DFSS and then of course state IDHS and DCEO to really try to make this one-time grand investment in communities something that is not only sustainable, but really makes a true impact. And then again, we're positioning young adults and their families with the resources that they need. The pandemic has been tough on everyone, but it's been especially tough on our young people. We've seen the highest levels ever of out of school and out of work youth. So 16 and 24-year-olds that are completely disengaged from the systems that they're normally engaged with that help them kind of navigate life. And so we're really working hard to not only reach those youth, but then when we reach them, reach their families as well to help move the entire family again along that economic mobility spectrum. Next slide, please. So again, the county labor market. So we serve not only job seekers, which I've talked about, but also businesses. And right now, businesses are the ones that are really knocking on our door in need because businesses have fought very hard to make it throughout this pandemic. And a lot of them have, and a lot of them have not. But the ones that have are kind of getting by on a shoestring. They need people, they need support, and they need a talented workforce to help them to be able to stay open and expand their businesses. Now, we truly believe that there's talent and pools of talent throughout the county that if businesses work with us and work with our agencies, they're able to tap into those. So the industries that we focus on are the kind of high growth in demand occupations and sectors that drive our economy. So business, professional services, construction, healthcare, IT, manufacturing, retail, culinary, hospitality, all the things good that go along with making the city run. Then of course, transportation, distribution, and logistics. Next slide, please. So this is our system overview. This is kind of a very high level overview of how we do what we do. And when you think about how you could fit into potentially to our different funding streams, think about these either as different parts you could play in our kind of workforce development ecosystem. So we utilize data, sector strategies, recruitment strategies, talent pipelines, all these things to reach job seekers, employers. We leverage business services teams at our agencies and at our own department, career coaches, and then training providers to bring it all together to then really try to make an impact for those employers and for those job seekers. So think about, again, how your organization could fall into one of these kind of narrow bands to help move things along. Next slide, please. Again, this is just how we help employers meet their needs, promote and advise kind of local things, layoff aversion, downsizing, services and outplacement support, and human resources and consultation. Next slide, please. So this is kind of how we're doing our initial ARPA investment. So we're looking at a little over $6.5 million for this first year. The big thing that we'll be launching to keep an eye out for will be enhancing our Opportunity Works program. So this is something we do throughout suburban Cook County to reach those out of school, out of work young people. It is a 12-week program where people go through a paid work experience while they're also getting mentoring and other supports around them. So hopefully those RFPs will be released in the next quarter to, again, amplify that program as we work with our partners at the County Bureau of Economic Development to again, kind of plan out how we're going to best invest in families and youth. Next slide, please. And this is just our impact. We like to show that we are outcome-based and impact-based, and that the funds that come to us, we leverage to make the biggest impact possible. So this is just a little bit about who we are and how we've served people, but I want to make sure that we have time for questions. So this is the end of my presentation. I'll hand it back to, I think, Lynetta now for questions.
Yes, thank you so much, Patrick. And one of the first questions that came through for you was whether or not the Chicago Workforce Partnership as a not-for-profit competes with community-based organizations for funding. Can you clarify that?
Yeah, absolutely. So we do not. We work in a space where we see ourselves as kind of a lead coordinating entity. So we do not compete with kind of local smaller nonprofits, whereas we like to take kind of these big ARPA federal workforce investments, braid them together, and then put those out to RFPs for smaller nonprofits. So no, we usually do not compete with local CBOs.
Thank you very much. So I want to thank all of the presenters, Secretary Grace Ho, who had to leave, DFSS Commissioner Brandy Kanazi and Raymond Barrett, and thank you to Patrick Combs. So let us quickly go through and see which questions are associated with the human services. We are set to start public health at about 3:30. So those presenters, if you could just stand by, we want to make sure that there are no specific questions to close out this panel. So I see one question, and I think this is directed for Brandy. Can you provide the contact info for lead person from DFSS who can answer questions about their RFPs, or is there another contact person? I believe Brandy and Raymond, you guys have put in your contact information in the chat, but are there other ways for them to ask specific questions about your RFPs?
So if a person has a question about a specific RFP, each RFP lists the RFP captain. And so their email and phone number is listed on the cover page, you'll see, but also right after the evaluation criteria, there are a couple links. There is the name for the technical assistant. So if you're having problem with the e-procurement system, it'll give you the number for OBM. Also, the technical person here, who is Julia Talbot, and I don't have her number off the top of my head, but like I said, the lead person for the RFP that can give contextual questions about the actual program is listed in each RFP. I would say that the best thing is to attend the TA session for each RFP that we have. That's where you have the subject matter experts. You can ask questions after each TA session. We do post all of the questions online.
All right, thank you, Brandy. I don't see any other specific and relevant questions for the Health and Human Services track. But if you all could all kind of stay on, but we have many of our presenters from the violence prevention segment as well as human services segment. And so at the end of the day, we will go back and see if there's any remaining questions. So thank you very much for your presentations. So we are going to shortly start with the public health, including mental health. And we have a great presentation from the City of Chicago, the Chicago Department of Public Health Commissioner, Dr. Allison Arardi. And we have CEO Israel Roca from the Cook County to do presentations. So I want to make sure that they are both on. So we'll give them a moment. So many of you may need to check your emails or check your text messages. So we will come back in a quick moment. All right, we are back. And so we are starting the public health, including mental health segment, which is the last segment of the Track A community services. And once we go through those, we will open it back up for additional questions. So I'd like to see if Chicago Department of Public Health is ready to go.
I'm ready.
All right. Thank you, doctor. Go ahead.
Thank you. Good morning or good afternoon. Thanks everybody who's hanging in on this long Zoom call. We'll be talking today at the city level about opportunities for funding in public health, including mental health from the Chicago Department of Public Health. Next slide. So there are quite a lot of new areas of funding and new projects that are happening through CDPH as the result of ARPA recovery funding. There's about $55 million total through ARP that is going to violence reduction and victim services. That is all happening through the Community Safety Coordinating Center. And those of you who are on the violence reduction portion of this afternoon heard the details about that. We have about 20 million going into expanding our trauma-informed centers of care, mental health, outpatient clinic network, more mobile behavioral health care, and some more intensive treatment for people who have both mental health and substance use needs. It's about 15 million ARP for 911 call diversion, thinking about alternate response. And again, where do we bring folks who have acute mental health needs that is not the emergency department? Where can we bring folks that make sure their emergent health needs are met, but with some more long-term follow-up? There's 12 million to create high utilizer diversion housing for folks who are frequently being transported by emergency medical service or frequently seen in the criminal justice system. $5 million for a sobering center, an alternative to hospital or jail for publicly intoxicated individuals, again, to help create alternate destinations and link to treatment. It's about $25 million to expand Family Connects, which is our hope to be eventually universal, meaning for all new babies born in the city of Chicago, offering a home visiting program by a nurse to do an assessment of mom and baby's health and connect the family to resources. $10 million for community-based resource navigation. This is in line with the Department of Family and Support Services and building out what 211 looks like. It's $47 million from the bond to be able to increase our ability to abate lead in households. The #1 way children are lead poisoned in the city of Chicago and in the US is not through water, it is through old lead-based paint. And this lets us fix more of those situations. $9 million through ARP for what we call a cumulative impact approach, which is some approach we need to have for environmental justice, ways to be able to monitor pollution, tools and staff to address environmental hazards. That is largely being addressed in the separate infrastructure environmental meeting. And then $24 million in the bond to remediate historically contaminated land and also allow us to invest in additional air monitoring technology. In addition to this, there are ongoing COVID and then base CDPH program opportunities. Next slide. So to get specific, we have an anticipated timeline here for CDPH RFPs and contracts that we expect to be issuing in 2022. As always, timelines could change, details could change, but we are expecting early 2022, by which we hope in the first quarter, we'll be looking for multiple delegates, specifically mental health clinical providers, to expand our trauma-informed centers of care mental health clinic network citywide. So these are clinics, existing clinics that provide mental health care and would like funding to join the network and to be able to serve all Chicagoans regardless of insurance, immigration status, ability to pay. And this has been very successful in the initial launch, and we want to take it to the whole city. We will be looking for multiple delegates to expand street outreach work for violence prevention, as mentioned in the first session, multiple delegates to support Family Connects in 6 Chicago regions, connecting families with newborns to existing supports and services. We'll be looking for a delegate, a mental health clinical provider again, to embed additional mental health professionals beyond the one CDPH has in the 911 call center. And we'll be looking for a delegate, a clinical provider to help provide treatment and clinical support as we develop our high utilizer diversion housing. So particularly someone with expertise and interest in mental health and substance use treatment. Mid-2022, we expect to be putting out an RFP looking for delegates, again, clinical or nutritional providers to operate 6 WIC clinics. That's the Women, Infant, Children Federal Nutritional Need Program, beyond the ones that CDPH operates. We'll be looking for a large delegate to coordinate neighborhood-based community navigators, connecting residents to city services. We'll be looking for delegates, a mix of clinical providers and CBOs to expand victim services, to provide healthcare and social services to people impacted by violence. An RFP for some delegates and seed grants to community-based organizations to be able to lead some local and hyperlocal environmental justice and protection strategies. Some contracts to order and expand air monitoring equipment in conjunction with the county and the state, and to expand our Family Connects newborn visiting on the hospital side. Delegate to coordinate licensed subcontractors for lead paint abatement, as well as healthy homes improvements in homes with young children, and then vision providers. This is not new work, but this one is due to support CDPH's school-based eye exams and eyeglasses program in CPS and to support quality assurance of that program. And then later in the year is when we expect to be looking for some additional delegates, clinical providers, to help support the alternate destination and some of the response for people calling 911 for mental health emergencies as we build out that system, and a clinical provider to help support the new sobering center, and a new contract to help support remediation of abandoned gas stations and other environmentally contaminated sites. Throughout the year, of course, additional RFPs or contracts may be issued as we continue or expand COVID work, as we're working on healthcare associated infections and lab work, as we're building data systems capacity, as we provide housing supports for people vulnerable to or living with HIV or diagnosed with tuberculosis in our regular stream of work. Next slide. So the kinds of applicants and bidders who will be eligible to apply will be looking for clinical providers, by which we mean hospitals of all sizes, outpatient clinics, including federally qualified health centers, and mental health providers of all types, who have strong community connections and who are willing to accept funding to provide care to all Chicagoans, again, regardless of insurance, income, or immigration status. Really looking to expand that network of no and low barrier mental health and substance use treatment across the whole city. Secondly, we'll be looking for community-based organizations that have experience convening diverse sets of stakeholders to solve local problems, and that's across the range of issues. We'll be looking for organizations that know their communities well and hire from the communities where they do the bulk of their work, ideally including hiring people who may have had previous barriers to employment. And finally, of course, organizations that focus on promoting health equity and demonstrate interest in using data to drive public health action and evaluate results. So please make sure you follow along, sign up for things. There's a lot of work to do. We're really excited about this ARP and this investment in public health in a way that goes beyond COVID, centers community, and works on a lot of the most acute issues we want to work on in partnership with the county and the state. So thank you very much for your time. And we look forward to, answering questions and then hopefully receiving applications from people who are interested.
All right, thank you, Dr. Arati. There are a couple questions that I'd like to see if you could quickly answer. We're going to pivot a little bit since it's right after you spoke. Someone wants to know what funding is available for telehealth, telemedicine projects or pilot projects.
So we may have, particularly in that mental health space, we're waiting to hear a little bit where the federal government lands on the final telehealth extensions, which we are very much hoping for. We are exploring the use of telehealth, especially for things like being able to start substance use treatment, medication-assisted treatment, day of, using a mobile model, and a telehealth model. And we already use quite a lot of telehealth in our mental health treatments. And so mental health providers that have a telehealth component, will definitely be interested in hearing from you.
All right, there's a couple more. A participant asked, what do you mean by looking for delegates? Is that a position to be filled or things for agencies to do?
Great question. That is things for agencies to do. So a delegate agency means typically the Chicago Department of Public Health has usually received federal funding of some kind, in this case, ARP, sometimes it's CDC grants. We have to deliver on that grant. And depending what it is, often the health department might do some portion of that work. And then we will look for a delegate agency, which means a clinic, a community-based organization, a healthcare provider, especially in the communities that we are interested in. We then basically delegate some of that funding and the responsibility for being our partner on getting that grant work done. So those are not hires. We are also hiring plenty of people at CDPH, and folks should look there, and we'd love to get plenty of new people in. But no, these are specifically for organizations that would like to receive funding or be considered to receive funding in some of the new work that CDPH will be doing.
All right, and if you could drop in the chat the link for CDPH RFPs that are posted already. But then there are a question about our programs that address food insecurity and nutrition eligible for CDPH funding.
Yes, so there's quite a lot happening with food, food security. None of that funding is coming directly through CDPH. So I specifically spoke to the ones that the funding is coming through CDPH, but CDPH works with, I know that there is quite a lot happening in this space and there will be opportunities. And to the point of where do you follow for RFPs, we use the exact same system that every city department does. So whenever there is an RFP coming, and an RFP, a request for proposals, looking for a delegate agency, looking for a contractor, those come out in the same system. And so as long as you're registered for that system, you would get alerts if there are opportunities from the health department, just like you would from the Department of Planning and Development or anybody else.
All right, thank you. And I know that there has been a couple comments and we certainly echo, thank you for helping us get through the pandemic. I know we're not all the way there, but we appreciate all of your efforts. I think everyone, you're a household name now, so thank you.
Thank you. Well, everything we've done in partnership with community, everything that's gone well. And this kind of opportunity is what really lets us get that funding out where it needs to go and partner with really folks doing important stuff on the ground. So thank you all very much.
All right, so if you could stay for the rest of the segment, where there are a few other questions, but I want to turn to Cook County Health.
Hey, Lynetta, can I jump in?
Go
My
ahead.
boss is standing there. Can we just acknowledge that the mayor has shown up?
Hello, Madam Mayor, how are you?
I'm well. I'm just going around to the various panels to listen in a little bit and see how it's going. And I just want to again thank the state, the county for the partnership in this work. And I hope that the folks who have been participating throughout the day are finding the information that's being shared very helpful. And I'll just keep encouraging people, if you got questions, concerns, issues, put them in the chats so that we can hopefully respond to them real time. But otherwise, all the teams are going to be poring over the information that's come from the chats to use to refine the information that we're providing. And I think this has been said, but this is a start, not an ending of engagement from all of us. So again, thank you, everyone. I just wanted to say hello.
Thank you very much for popping in. Thank you, appreciate it. All right, so let's go to the next presentation, one of our very own at the county, Cook County Health and Hospitals, CEO Israel Rocha.
Hi, and good afternoon, everybody. We're very happy to be here. I want to start by expressing my sincere appreciation for the wonderful collaboration that we have had with our city and state partners. On behalf of Cook County Health, we have been incredible partners to make sure that we had great resources as our communities face the difficult task of going through the COVID-19 surge together, and really want to say that it was a great partnership that let us be here. So today I wanted to start a little bit to talk about Cook County Health. So on the next slide, if you could move forward to the slide that says, there we go, perfect. For Cook County Health, to tell you a little bit about our system, we have served as the busiest healthcare safety net in the Midwest for over 180 years. As a system, we serve more than 600,000 individuals through our health system and health plan every year. Nearly 850,000 outpatient registrations are conducted annually. We provide more than 1 million outpatient prescriptions, and we provide care to more than 100,000 emergency trauma visits through our emergency department at our Stroger Hospital campus. Through our correctional health program at the Cook County Jail, we provide care for 30,000 individuals. Our care program includes facilitating intake screenings on an ongoing and managing ongoing care plans and the distribution of 3 million doses of medication annually. We also care for over 40,000 visits at the Ruth Rothstein Core Center, which is one of the busiest HIV treatment centers in the United States. On the next slide, you can see real quickly our presence on our campus. You can see that we are geographically distributed throughout all of Cook County, both in the city and suburban areas. Cook County Health is a vibrant system, and we have our hospitals, which we have Stroger and Provident. We also have the Cook County Department of Public Health. We have our operations at CIRMAC and our correctional health services, and we have 13 locations throughout the entirety of the county, both in city and suburban areas. all the way from the north to the southern end of the county and east to west. We are covered to make sure that we are here for you. And all you have to do to make sure that you get the best care that we can provide is to come into one of our locations, and we promise to be here for you and an exceptional care partner. On the next slide, you can see a little bit about what Cook County Health has done over our journey in responding to the COVID-19 pandemic. So we could go to the next slide. I'll wait a second so we can cut up there. There we go. So during our COVID surge, Cook County Health assisted our community by providing more than 300,000 COVID tests to residents throughout our community. We operated a mitigation and prevention efforts at the Cook County Jail. We provided acute care to nearly 2,000 COVID-19 inpatients, and we provided close to 1 million doses of vaccines through our mass sites, priority sites, pop-up clinics, hospitals, and equity pods. And to date, we have helped vaccinate more than 525,000 unique individuals. We're so proud to the amazing team here at Cook County Health who has been here to make sure that our community got the care and attention they received. Next slide. This showcases a little bit about the wonderful work that our public health department has done, especially in the suburban Cook County region. Throughout the Cook County Department of Public Health, they have implemented a contact tracing program for suburban Cook County, issued mitigation orders, and conducted inspections to ensure compliance with COVID-19 measures, restrictions, and programs, provided technical assistance and guidance to congregate settings such as long-term care facilities, schools, and other partners throughout the pandemic, distributed vaccine to suburban Cook County providers and partners, including Cook County Health, focused on programs for vulnerable populations throughout the COVID-19 response in partnership with Cook County Health to make sure that everybody got the care that they needed at the place that they needed it, the time that they needed it. Hosted workplace technical assistance sessions on COVID-19 safety protocols, engaged community-based organizations for contact tracing and vaccine outreach, and assisted schools with contact tracing and school mitigation measures. On the next slide, you can briefly see how our suburban Cook County Department of Public Health was able to make sure that we provided information to be able to have individuals see the work that we were doing. This showcases that how we were able to operate a hyper-local vaccine program that makes sure we got to the communities that were most impacted during COVID. You can see that 31,820 doors were knocked, partnerships with our community-based organizations to make sure that homes and areas that had been hardest hit by COVID-19 were not left behind, that they got the information and education they needed to make the decision to be vaccinated. Over 47,675 total vaccines were given either in homes or at equity pods and across the community where they needed them. 4,223 total in-home vaccinations were conducted for individuals who had mobility challenges and couldn't go to a mass vaccine or to go see their doctor as easily. And 1,879 vaccinations were given at Cook County Department of Public Health owned events, where those included mini equity pods, mobile sites, mobile vaccines, everywhere that we could be where you live and work to make getting the choice to get vaccinated seamless and easy for families who have to make the decisions and to be able to provide for their care timely. Next is the exciting part of what we're here today. We're going to go a little bit more about how we're looking ahead on the next, we're going to be looking ahead to review for ARPA funding. New projects through the Cook County Health and Cook County Department of Public Health partnership. The county behavioral health investments will include grant awards to different community organizations. We will be making very strategic investments in behavioral health and opiate overdose prevention throughout suburban Cook County. We will have programs that will allow for housing for health that will include medical respite, flexible housing pool, and emergency room interventions, alternative emergency room interventions, expansion of food security programs. We'll be working to make sure with our suburban partners that the Cook County Worker Protection Program is expanded. We will be broadening Cook County Health's Healing Hurt People program to assist individuals that have been impacted by violence. The Cook County Department of Public Health Emergency Preparedness Expansion Programs will be looking to make strategic investments to enhance our emergency preparation, safety net, and response programs. The Cook County Department of Public Health Building Healthy Communities initiatives will be looking to include new awards that will focus on the greatest needs that our communities have through targeted community grant awards. The COVID-19 vaccination incentive will be looking at how we can expand and partner with community-based organizations to continue the journey to make sure that everyone who needs a vaccine and wants a vaccine gets a COVID-19 vaccination so we can bring an end to this pandemic. And the Cook County Department of Public Health will be looking for partners to be able to lead mitigation efforts, education efforts, and to continue working on addressing the substantial challenges we face in our community to help end health disparities in social determinants of health in key communities, to make sure that we have the tools and resources you need to make health equity a reality. And we will deploy additional community health workers in suburban Cook County. We'll be looking to work with different organizations on how we can bring this program to life, do education, and do capacity building. And we will have hyper-local in-home COVID-19 vaccination programs. Those are some of the key areas that we will be looking ahead to fund. Again, what we want to be clear is that there will also be some other additional programs that we'll be looking to fund that will make sure that the biggest ideas that are available, whether they be, and by big ideas, we mean the ones that will have the most impact in the communities we serve. That could be anything from making sure that we have the resources the community-based organizations need, to starting a brand new health service line or mental health agency to make sure that we're meeting the needs of our community, from mental health to primary care to specialty care and everything in between. And that we have the entire array of programs that support our patients, our residents, when they're transitioning from an acute event to a primary care ongoing health maintenance, to even what they need to make sure that they can live their life and that everybody can live the healthiest life that they can with the support that they need. So we'll be having some new programs that will help to work on those areas. We look forward to hearing from our organizations that we work with and from today, and being able to say that this is a starting menu. We look forward to see how we can help you. On the next slide, you will see a little bit about the anticipated timeline and next steps. So the timeline for grants to be shared will be the spring and summer of 2022. And we look to make sure that we get your feedback and your ideas to go to monitor and have the feedback at engagecookcounty.com for updates, timelines, information, and ways that we can stay in touch and communicate. Beyond addressing the healthcare needs of our community is an ongoing conversation that we aim to make sure we can achieve success together. Thank you so much for your time and attention, and look forward to your questions.
All right, excellent. Thank you, Dr. Rocha. And again, to you and your team, all of the doctors and the hospitals, and Dr. Joshi, Dr. Rubin, thank you all also for leading us through this pandemic. All right, everyone, we have had a long track A, but we hope that you have gotten a lot of good information. Before we go back and open up and finalize the questions, I want to make sure that I kind of reiterate a couple things. First and foremost, we will be posting the full deck of all of these presentations on our joint website, greaterchicagotogether.org, and you will have the opportunity to really go through in more detail for all of the presentations from the state of Illinois, the city of Chicago, and the county of Cook. So that's the first one. The second is, this is intended to be a very high-level presentation. We don't have all of the answers, we don't have all of the information, but we wanted to, in full transparency and a commitment to collaborating, come before you today and give you what we do know. And there will be many, many more opportunities in the future, both jointly and individually, as each of these agencies begin to really roll out their various solicitations. When you see those solicitations that will be posted on their websites, please make sure you go through all of the fine print. All of the answers in terms of eligibility criteria and guidelines will be posted there. While we are doing our best to coordinate across all of the agencies, there are going to be some differences in what the expectations or guidelines are from agency to agency. So please make sure that you are looking at those solicitations. Furthermore, as always, when those solicitations are posted, there's usually an opportunity, some call it a bidders conference, some will say a technical assistance webinar, where you can ask very, very specific questions about that particular RFP, including whether or not you are eligible to apply, what the service areas are, what the outcomes are, and the amount of funding that you can request. So I wanted to just make sure that everyone understands that. We really have appreciated your help and assistance in all of the questions that you all have had over the course of the day. Beginning this morning, if you participated in the plenary sessions in the morning and in this segment, track A, both for violence prevention, human services, and last but not least, public health. So there are some additional questions related to public health. I hope Dr. Rocha, Israel CEO Rocha, can stay on along with Dr. Arardi. So let's see what we have here, and we will ask those questions. Give us one moment while we check and make sure that we are able to answer all of the questions that have just come in. All right, so this one is not necessarily targeted towards public health, but there's been a general question, and I think I'm going to direct this to the City of Chicago. Have we been missing services for seniors and caregivers for seniors? There's been a few questions about the Mayor's Office of Disability and what opportunities are going to be available for the disability community. So wondering whether or not Brandy perhaps can answer those questions.
Speak to Lynetta, the senior services component of it. And so through the Illinois Department of Aging, which is under the Illinois Department of Human Services, we are receiving ARP funding. So it's not coming directly from the feds, it's passed through the state. And so we will be releasing RFPs for seniors, including meal programs, additional chore programs, assistance with light duty repairs that we're going to work with DPD. So there will be some programming for seniors that will be coming out that we didn't address today. They will still be on the same website that I posted earlier. In terms of Mayor's Office for People with Disabilities, we can provide feedback in the Q&A that will be coming out.
Excellent. Thank you, Commissioner. All right, so there is another question, and perhaps this, I'm going to open it up to Israel and the doctor. Could there be funding available to expand the pool of mental health providers, especially those who are bilingual and familiar with the communities where they would be working? Would either of you want to answer that question from your agency's perspective?
Yeah, I'm happy to from the City of Chicago. So people may not know, but one of the major things that we've done newly under Mayor Lightfoot is build a network of clinics all across the city. And we are especially interested in partnering with clinics that serve underserved communities and have linguistic access, et cetera. And this is what I was mentioning, we are looking to expand that network to the entire city. We started in the parts of the city that are most in need of no barrier mental health resources. So to be eligible, and of course you would have to look at the details here, but you would apply. We do expect this to be an RFP coming out soon in the first quarter. And you have to, by definition, with this money, serve Chicagoans, regardless of whether they are insured, regardless of whether they have a particular immigration status, and regardless of their income level. And so we sort of give extra points for language ability and cultural competence and all of this, but we are definitely looking for providers of all kinds to apply, so we can really expand this network across Chicago, knowing that there's major need for it.
Sure, and this is Israel on behalf of the Cook County Health in the county. I can say that we equally are very committed to ensuring that across the entirety of the county that we have a sustainable mental health safety net. And so we're looking at a lot of different ways to partner with different organizations, and we can make sure that that safety net is there across all the different types of mental health services that we need to provide. And that is anywhere from providing peer support groups to being able to provide clinical social workers, licensed clinical professional counselors, psychiatrists, psychologists, activity therapists, and spanning anything from a MAT program all the way to a chemical dependency program, to an acute intervention, to ongoing mental health and safety care. And so we look forward to providing with you. We will have some applications that will be coming out, and we're going to be having some real exciting news coming forward about how Cook County Health and Cook County are going to take some aggressive strides to ensuring that we can hopefully work together in partnership to make sure that we have a comprehensive mental health services program throughout our community. And very closely, one of the things that we talked about was looking at how we can start to organize our mental health services collaboratively across the community. And that's across all providers, all payers, all processes, because we know very carefully that mental health is a continuum of care. If you're offering care today for ongoing patients, very quickly you might need an inpatient service, or you might need a substance use disorder patient, or you may need ongoing benefits and services, whether it be food in homes or different types of programs. And we want to make sure that we have all those services combined together. And so we look forward to having some great opportunities. They'll be coming out, as we said, in the spring and the summer, and look forward and ask you to make sure that you stay with Engaged Cook County, as we'll be having some very exciting news about how we're going to be expanding mental health services together throughout the entirety of the county.
All right, thank you, Israel. There's another immediate question for you. Are the Cook County Public Health grants primarily for suburban Chicago? Can Chicago organizations apply even if there is overlap with CDPH?
So, as we always say, we're a little bit of both. We actually work as Cook County Health with Dr. Arwadi in programs with the city. And then with Cook County Department of Public Health, we work as the suburban public health department. And so we will have grants. There will be some that will be available for the city, and some that will be reserved for the suburban jurisdiction under the Cook County Department of Public Health programs. So I would say make sure that you look at the programs we're applying. Cook County Health does some direct grant programs of our own. When they're under the Cook County Department of Public Health, that will work in the suburban areas. So we'll have grants available for both, and look forward to working with you.
Okay.
And I would just chime in on that, Chicago Department of Public Health, Cook County Department of Public Health, we do try to, we keep track of what each other's doing. Sometimes when we receive federal funding in, we'll divide it up based on burden between suburban and city. And it's good to sort of be on both lists, if you know what I mean, if you're interested in particularly, I think, in the behavioral health space, which is one of the spaces that we are all growing the system in together.
Excellent. And Israel, the last question, if you could just, where can you find the updated opioid overdose data for suburban Cook County? Can you drop that website in the chat?
Absolutely. And I think Dr. Joshi is with me as well, and he can tell you the links, but we can make sure that we drop it into the link as well, so you can get the updated information. Dr. Joshi, do you want to add any information to that?
Thanks so much. I'll drop the website into the chat. Thank you.
Okay. All right, so here's a general question I think that is applicable to all of our presenters, from those who did the violence prevention segment a little earlier, human services and public health. There's a general question about kind of confirming that the flow of the grant funds from the American Rescue Plan is not the only grant funds that we've been talking about. So I will say that across the board, that is correct. While many of the agencies are planning out how they're going to be leveraging ARPA, their traditional RFPs and those funding sources will probably remain. And so you have gotten kind of a sneak peek of what's already existing and will be put out, as well as what new opportunities will come out as a result of the substantial funds, federal relief funds from ARPA. So just answering that question. Okay. So I want to go back up. There were some very specific questions around violence prevention that we didn't get a chance. And we have our segment was supposed to end around 4:15. And if you guys can bear with us, we want to make sure that all of those questions were answered. So if the city of Chicago, particular, I'm thinking Marlita and Rebekah, these are several questions targeted towards the city of Chicago around the violence prevention segment. So the first one is regarding the Community Safety Coordination Center. What type of agencies will be located there? Can one of you all speak to that?
Hi, actually, Lynetta, I want to see if Wayne Daniels is still available. He is providing direct support.
Okay. Wayne, you're up. All right, he may no longer be with us, but
Okay.
Marlita, if we could maybe get that information, if you could, and put it in the chat, we can circle back around and certainly try to answer that question.
will.
Another question was around.
Lynetta,
what's
do you
the-
want to go? Do you want to go back to it? We can just speak briefly on it.
Oh, go ahead.
So the CSCC is an initiative that the mayor stood up in August, and it brings it together a whole of government approach. And so multiple city agencies sit together to make sure we see violence holistically across the city, that we're not duplicating efforts. And so we have a staff member who sits in the CSCC. They work closely. And really the goal is working with community partners to understand the best ways to address violence and leverage resources. So it's a new initiative that was started for a whole of government approach.
Okay, thank you very much. There's a related question around the plan for trauma centers in Chicago neighborhoods. Can you or someone from the city speak to that? Or public health? I think it may be applicable to human services and public health. Anyone want to take that?
Hi, it's Marlita. I actually think that Dr. Already spoke a little bit about this in her remarks, and it sounds like you want to weigh in again.
I was just going to say, so if you mean trauma centers like emergency, is the question about, you know, I'm not sure if the question is about sort of emergency departments and places to receive care for trauma, or if this is about sort of trauma-informed mental health
I think
care.
this is probably around trauma-informed services. That's my educated guess. It came in a little earlier, I think, while we were under the violence prevention segment.
Okay. And they're wondering about what that funding is like?
What's the plan for trauma centers in Chicago neighborhoods? Or is there a plan for trauma-informed centers within Chicago?
Yeah, absolutely. So trauma-informed centers of care, or TICs, is what we call the clinical settings that together are making up a network of places where Chicagoans can receive high quality mental health, substance use, and in some cases also primary care. And all of these, basically, if they are part of this network, they receive funding from CDPH. That funding is to be used to expand things like the ability to make sure you can serve people without barriers, to expand language access. Depending on the setting, we see places using the funding to bring in additional child psychiatry or group support, depending what the need is of the community. Those are absolutely based in neighborhoods and communities. That is the goal. And the goal is to support and grow. And then one of the reasons we call them trauma-informed centers of care is there's some practices that we use across all of these clinical settings about being trauma-informed, about how to support, how to make sure when people are coming in for medical care or behavioral health care, that they can get connected to the other needs that they may have, whether that's food insecurity, you know, housing needs, things like that. And so it's sort of joining this network, but these are in neighborhood. That is 100% our goal.
Thank you very much. All right, so there's a general one, and I'm going to go all the way back to the violence prevention segment, those presenters, and maybe ask for you all to start. And actually, this is probably general enough across the board. I think early in the morning in some of those plenary sessions, some of the agencies, particularly, I believe the city of Chicago, talked about their reimbursement model and how they were trying to make some changes there. So we've gotten quite a few questions about whether or not these grant opportunities are going to be on the reimbursement model or the advanced model. So perhaps we start with the city of Chicago. If you could just at a high level, if you know that answer, we'll do the city of Chicago, Cook County, and then the state of Illinois.
Do you want?
Marlita, do you have a sense?
I'll take it. I'll take it.
Allison's gonna take it, Lynetta.
Yeah, generally, Traditionally, as those of you who have previously partnered with the city know, we have historically used a reimbursement model. Sometimes there are grants that require that. I will tell you, I know that there is certainly interest, and we've heard from a lot of folks about the ability to, in some areas, be able to more provide some funding up front. That's something that our procurement and other teams are working on. I can't guarantee when or for which this may be in place, but I do know it is something that the city is very actively working on, and it's something that CDPH really wants to see happen. So I would plan for these to be reimbursement, but certainly if there are some, once this is in place, and I do think this year is the thought, we will obviously be making that known at the time when the details of each of the funding opportunities are released.
Excellent, thank you. Cook County.
Sure, this is Israel. I can start, and then definitely someone can chime in. Exactly as what Allison said, I think we are going to be looking at what we can do. We'd love to have some startup funds. We know that seed capital is critically important, especially when you're starting a new service line, bringing on providers, trying to expand those services, and even just your staff or the program cost to be able to do service community projects. So we're going to look to see what we can do. We hope really to start an innovative process that we're exploring through together with the county and with our teams to look at how we can be able to give some startup capital. So I don't want to say that it would all be in advance, but we are looking to see what we can do to be able to have a grants process that allows us to give some startup capital and then work as we are able to discuss measures and performance in that process. But we really do know that startup capital is essential. And so we're going to try to see what we can do to make sure that the grants are innovative, they're flexible, and they allow for some initial investment where appropriate on some of the grants. Some of the larger ones may have different restrictions, but we are going to try to make sure that we accommodate, especially for the smaller organizations where that startup capital really makes a difference between participating and not. We're going to look to see what we can do for you. And so I look forward to have the conversation go forward. Hopefully you'll be hearing some more information over late spring, early summer.
All right, thank you. And if Avik Das could speak to the Justice Advisory Councils for the violence prevention, the same question around, are you doing reimbursable grants, or how does that work when someone applies for grants and is a recipient?
Thank you, Lynetta. Our presumption is to work towards advance. That is how we've been doing our existing grant portfolio. And in this particular violence prevention solicitation that we referenced in our presentation, the goal would be, depending on the size and sort of the individual sort of proposals, the goal would be to default towards advance payment for as much as possible.
Excellent. And last but not least, the state. Do we still have Assistant Secretary Patterson on?
It is not, but I could feel that question.
Go ahead.
Jose Ponce, Director of Grants Administration for DHS. So much like our counterparts, traditionally we work off of a reimbursement model, but there will be on a case-by-case basis, either depending on the program itself or how the applicant scores on their pre-qualification, pre-GATA certification, an option to receive up to 25% upfront of their grant application costs. So, and that will apply across all funding opportunities that DHS will offer across its different funds or funding sources.
All right, thank you. And folks, this happy Friday afternoon, we are at the time of close. We know we may not have been able to answer all of your questions, but as I said, there will be plenty more opportunities, both in coordination with the state, city, and the county, as well as whatever bidders, conferences, and other information that they will be posting on their respective agency websites. We certainly appreciate you all's participation today, whether you stayed all day, you popped your head in, or you stayed for the entirety of Track A. On behalf of my boss, Cook County Board President Tony Preckwinkle, Mayor Lori Lightfoot, Governor J.B. Pritzker and Lieutenant Governor Juliana Stratton. We really appreciate you all's partnership, and we hope that you have a safe weekend. So thank you. And remember to check periodically greaterchicagotogether.org, or you can go directly to the individual websites. Want to give special thanks to all of our presenters. If you all know the flurry of activities over the last week or so to get here and to be ready. So I want to thank Tina Hone, who was the one that said, we can do this and we can pull it off in a week. And she was right, we did. I want to thank all of the presenters from the violence prevention track, Rebekah and Marlita from the city of Chicago, Avik Das from Cook County Justice Advisory Council, and the state Icee Del Reese Adams and Christopher Patterson from IDHS. For Human Services, we had Secretary Grace Ho come in. Thank you very much. Jose helped support her. DFSS Commissioner Brandy and Raymond, and our Chicago Cook Workforce Development Board, Patrick Combs. And last but not least, our public health, including mental health, Dr. Allison Arardi from the Chicago Department of Public Health and CEO Israel Rocha, and I know Dr. Kiran Joshi was also on the call supporting. So thank you all for giving us your time, your expertise, your talent, and making us all proud today to be good public servants. So we're doing this on behalf of all of our residents that need it. We only have a short period of time to get it right. The next 3 to 5 years, we're all in this together. So thank you all for joining us today.